The CDC Museum Public Health Academy is the program through which the museum offers several options for people to learn about public health. We, of course, have our Museum Disease Detective Camp. We also have an online summer course. We have a teen newsletter, and then also STEM lessons that students or any curious adults can also explore directly on our website. We're in the middle of a week-long program that's one of 2 programs we offer in the summer.
It is day 4. So what we've chosen to do this morning is we're going to focus on global health and give you an opportunity to talk to, I think we have 18 CDCers coming.
This really provides an opportunity for high school students to get access and exposure to public health at that age where they're really curious about the world and they're wondering how they can make a difference.
We need leaders of tomorrow that understand the cross-discipline and the cross-sector opportunities for solving the biggest problems that we face.
During this week, we've done some work with epidemiology and some data analysis, and that's where a lot of the math comes in. We did some lab work. There's a lot of biological and chemistry work that goes into solving these diseases. It's all been really interesting to see those different ways that STEM fields play out in public health work.
We are spending more time in this country talking about mental health now. I feel like the exposure is very important because there are certain racial ethnic groups that are underrepresented in the field of public health, and that's the key. Exposure. If they learn more about public health, they'll choose this as a field and join us on this journey.
How many people die of tuberculosis in the world every day?
3,500.
3,500, excellent. All right, now here's the problem. Now you have to wait. It's supposed to be 60 microliters, so see that black line? Fill up that black line twice.
Throughout all of my life, I've known a lot about healthcare, but not specifically public health and the impact that you can make on populations rather than an individual person or patient.
I'm going to give you a disease and you tell me which country you think is the one that prioritized it. You have a one.
Getting students when they are at the high school level is very important. Here is an opportunity to let them think about what is a real passion. So they have a taste of what it can be in public health, and maybe that will help us to get the next generation.
And if you guys want to try on a suit, it's inflated with air normally, so it's pressurized.
Public health to me, it just kind of seemed like COVID or like, getting the flu or something like that. But after the camp, I've just seen the expanses of how far public health can reach, and it's really cool.
This week I learned that it's so interesting how many different diverse fields could all find a common ground and all contribute to one issue or an outbreak that everyone is trying to solve.
As we have more students that come through our programs, there will be a bigger ripple effect as we see these students go make a positive impact in their communities, as students, as citizens, but also as professionals.
That's going to be 30 microliters, and you want 2 of those.
Zika, chikungunya, yellow fever, those are all viral diseases.
I know in our everyday lives we might not know about different opportunities to be almost like a superhero, but you really get that chance through public health.